Subscribe to our YouTube channel. Press the bell icon to get the latest updates.
Yes, we need to watch the B117 spread. We certainly don't want schools to open and then reclose. The whole point is to keep schools open in the context of all the layered mitigation that we've put forward through the recommendations.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.
We continue to be encouraged by the pace of vaccinations in this country with 3 approved vaccines: Pfizer, Moderna, and Johnson & Johnson. There are now a total of 84 million people who have received at least 1 vaccination dose, or 1 in 3 adults, and 45 million people who've been fully vaccinated. That's better than 1 in 6 adults. Importantly, today we cross a milestone. 70% of Americans aged 65 and over have now received at least 1 shot. This is a long way from 7 weeks ago, when only 8% of seniors had received a single shot. Now, as a reminder, 80% of deaths in the US have occurred among seniors. Put another way, no country has vaccinated more people than the US. As a result of our 3-pronged strategy to rapidly clean supply, to add thousands of vaccinators, and thousands more places for people to get vaccinated. Yesterday, in our weekly call with governors, we announced that we will have 27 million doses allocated across all distribution channels this week. Today, at the Department of Education's National Safe School Reopening Summit, President Biden will announce that $81 billion in American Rescue Plan funds will be made available to all 50 states, DC, and Puerto Rico to support their efforts to safely return to in-person instruction as expeditiously as possible this spring and meet the needs of all students. This announcement builds on our ongoing efforts to support schools and staff by investing in testing and prioritizing teachers for vaccination.
Getting schools open for in-person instruction safely and as quickly as possible is a top priority for CDC. And here again, we are starting to see results. I'm excited to report that we've heard from a number of school districts since our updated guidance was released last Friday, that they're now able to move forward with broader reopening as a result of our updated recommendations on physical distancing. At the same time, we've been working hard with our federal retail pharmacy program to vaccinate K-12 teachers, staff, and childcare workers throughout the month of March. Our pharmacy partners now report they have vaccinated more than 1.3 million educators, staff, and childcare workers. About 566,000 of those were just in the last week. This is substantial progress towards our goal of getting our teachers and school staff vaccinated by the end of March. Our guidance that was put out early in February and then updated last week, it has a layered mitigation approach, and it has approach by different ranges of transmission. So areas with high transmission, we are limiting what we're recommending for in-person attendance in middle schools and high schools because of potential increased transmission for the older students. So we believe, and the science suggests, that 3 feet versus 6 feet would be possible, is possible, and it is safe when all of the layered mitigation strategies that we have suggested and recommended are in place. So 100% masking should be safe with in all of your schools, as long as you're talking about the younger children. And so, yes, we need to watch the B117 spread. We certainly don't want schools to open and then reclose. The whole point is to keep schools open in the context of all the layered mitigation that we've put forward through the recommendations.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.